Welcome to the African Institute of Medical Education's most recent endeavor, the survival of childbearing and pregnant mothers and their babies in Africa. This program was financed by the African Institute for Medical Education and through a funding program powered by Johnson & Johnson. Our altruistic goal in Uganda is to provide world-class training that, by extension, will reach tens of thousands of individuals in remote areas that would not have been reached otherwise. My name is Bob Britting. I'm the president of Health Initiatives, a healthcare process and communications company. Health Initiatives also focuses on the most advanced behavioral engagement strategies using something we call emotional science. We also work with marketing and sales to develop programs that are manifested from the science we apply to the healthcare professionals and consumers in the healthcare industry. But this video is about my business partner, Michael Kiaga, and my altruistic endeavors in Africa. The basic premise of our endeavors is there is a distinct need in pre-emerging countries. Let me take you through some examples. In Uganda, for example, 20% of the maternal deaths is attributed to malnutrition. And in the same country, 64% of the pregnant women are actually anemic. And unfortunately, 20% of the babies in Uganda die before they even turn 5 years old. All of AIM's programs are developed in the United States, but they're reviewed by the health minister in Uganda, Dr. Bernard Kiwanuka. The other person that you see in the slide is Dr. Elizabeth Thomas, an assistant professor at Drexel University and a pediatrician in Philadelphia, Pennsylvania. AIM arranged for Dr. Thomas to work side by side with the health minister to implement our latest program, focusing on pregnant women and their babies and malnutrition. AIM works, and it's proven. 97% of the healthcare professionals in our first program ranked the training a 9 or a 10. Our most recent program also garnered serious high marks. 90% ranked the training a 9 or a 10. There are 10 components that typically make up the training programs. In our last program, we trained 40 medical professionals. This translates to their interfacing with close to 80,000 patients in just 1 year alone. So far, we have a consumer and patient outreach opportunity of 140,000 individuals. We've chosen only a few of the diseases and conditions to make a point that there's a severe lack of education. 9 of 10 medical professionals knew less than 30% of the overall educational content. Only 3 of 10 medical professionals knew even 50% or more of the malaria education that's provided. Only 6 of 10 medical professionals participants knew 50% or more of the tuberculosis education. Only 3 of 10 medical professional participants knew 50% or more of the HIV/AIDS education. I'll continue just a little further. Only 3 of 10 medical professional participants knew 60% or more of the diabetes education. Relating to Rh factor testing, only 3 out of 10 medical professional participants knew 60% or more of the education program that was provided by AIM. And 83%, that's 83% of medical professionals did not know all of the malnutrition medical education materials that were provided by AIM. And now the results of the testing. AIM works. Well, we're finally at the end of the video, and we'd like to thank you for taking the time to view and listen to the video. We hope it was helpful. If you're interested in getting involved, just freeze this last slide and you'll be able to get our information.